South Dakota Storytellers brings you powerful personal conversations with South Dakota Hall of Fame inductees, individuals whose lives and achievements have helped shape our state and reach far beyond its borders.
Hello and welcome. I'm Jack Marsh, a 2020 inductee in the South Dakota Hall of Fame, and I'm honored to be the moderator of this conversation. You're joining us for the South Dakota Storyteller series, where we sit down with Hall of Fame inductees to explore the lives behind the legacies, their formative experiences, defining chapters, and enduring values. Over the past 50 years, the Hall of Fame has recognized more than 800 champions of excellence, individuals whose contributions have shaped South Dakota and inspired generations. Today, we continue that tradition of elevating excellence by listening, learning, and reflecting. I'm joined today by John Porter of Sioux Falls, a distinguished member of the Hall of Fame's class of 2018, as I recall, John. So thank you for being here and for your willingness to share your story. So let's begin. John, tell us about your upbringing, your family, those formative years.
Well, the formative years would be born and raised in Pierre. My parents had a small office equipment business there. Probably towards the end of high school, I set my mark on wanting to be a lawyer. So went to undergraduate at the University of South Dakota and stayed on for another 3 years through the School of Law. So I was either going to be an architect or an engineer or a lawyer. And for some reason, I was just smitten by wanting to be a lawyer. Yeah. And so kind of got down there, got into that. Actually, my high school sweetheart and I, we got married a year out of high school. We were in college as freshmen and got married. So it's been pretty well, Jack, 2 of us on this trip.
Wonderful,
and
wonderful.
So she got her nursing degree and put me through law school by working hard. So I'm very appreciative of that.
Of course. So, but tell us about those early years. You know, the influence of your parents. Did you have siblings?
Had 2 siblings, older brother and a younger brother. And so we tolerated each other pretty well. We didn't have a lot of big issues coming up. I was right in the middle. So yeah. My older brother had lots of thumbs down on him. I had moderate, more leeway. My younger brother had no supervision at all. So as people get tired raising kids, things change a lot. No, it was good. Neither one of my brothers ever really wanted to go on to get college degrees. And so they went into basically equivalent of trade schools back in those days, and he ventured into different types of work, into department store sales or into real estate sales. So, but I really stayed focused all that time on I wanted to be a lawyer. Really had a debate about do I go back east to law school or do I stay? And of course, we've only got the one law school here in South Dakota. Do I stay and do that? And I was convinced by a lot of the lawyers around here that if you're going to practice in this state, which was my intent, I love South Dakota. If you're going to practice in this state, go to law school here. You'll make so many relationships and people you'll be working with over the years.
Did that prove to be true?
It proved to be true. For a while, it proved to be true. As I came through that, I came into Jack, really a great law firm in Yankton, South Dakota, and started interning during law school with them over the summer months with 3 great attorneys over there, one of whom, Don Byerly, happened to be, amongst other things, a state legislator, both in the Senate and in the House, former judge, but also was legal counsel for the State Hospital Association, State Medical Records Association, and legal counsel for the Presentation Sisters out of Aberdeen for their health ministry. Not their educational ministry or world ministry, but their health ministry. And so when I came into that, I did start out in the mid-70s as a lawyer, doing a little bit of what we called health law back then, but I did divorces, I did criminal defense, I did all kinds of different things, just a general practice of law. But over a series of maybe 5 or 6 years, gradually, this is probably the first morphing in my career. No intent coming out of law school to focus on even health law as exclusive. And so within 5 years, Mr. Byerly and I were putting together what became the old Presentation Health System, which encompassed probably 4 hospitals, 1 in Montana and 3 in South Dakota, and 3 nursing homes. And that's everything. And so we're kind of dabbling along. We actually formed the Presentation Health System Corporation, and I became part of governance. I became part of administration. I became an employee in all of that, as well as doing legal work. So a lot of different hats in there, but probably I would say by the mid-'80s, 10, 11 years after I got out of law school, I really wasn't. I kept my bar license alive, because if I ever needed something to fall back on, I remember the state executive director saying, okay, you can go inactive, John. He was a family acquaintance of ours from here. And he goes, you can go inactive, but I want you to know, if you're inactive for more than 5 years and you want to reactivate, you got to take the bar exam. And I had never taken the bar exam. None of the 4 of us in Yankton had ever taken a bar exam. We all came through what was called diploma privilege. If you graduated, they'd take you in front of the judge, and the judge would say, yep, you're doing well. So boom, you're in. And so I said, okay, you'll have my check tomorrow. I'll have all of that, and kept it, but I never did practice again.
So, in high school, you imagine a career in the law, and it emerges to be something much, much different. You're introduced to healthcare through the law practice, and then through the sisters. Take us through this evolution from being an attorney for a small health system to being the CEO of the premier Catholic health system in the region.
It's a evolution, Jack, and to some degree maybe a revolution, but as we worked through the latter part of the 70s, the scenario was try to form more of a connection, because even with the Presentation Sisters, McKinnon Hospital in Sioux Falls, or St. Luke's in Aberdeen, or St. Joe over in Mitchell, didn't share a lot. They were almost like local community hospitals with sponsorship from the sisters and general oversight from the bishop. And so there wasn't a lot of connection with any of that. So when we went through, and I really was from, like I say, even first time I met any of the sisters in the health ministry was my summer internship. So I wasn't even part of the law firm then. I was just working there. And went back, and they really did. I mean, the way they got, comment you had made earlier, how does a Lutheran end up running a Catholic health system? For the sisters, they just wanted a commitment to their ministry. And that started early on. And solidly behind both Penny, my wife, and myself, being in the different roles, solidly behind us eventually becoming, I became an employee and then administrative officer, then one of the senior governance members fairly rapidly over that time. But you go through, and pretty soon you realize, I did for a few years general practice of law and worked both in governance and legal services with the presentation sisters. And so you can't do that. And so one of the things that really was there is, what do you want to do? And I can remember Jack coming out of a 2-day trial over in Vermilion against one of the premier trial attorneys in eastern South Dakota. But I came out of that going, do I really want to do this? Or am I more drawn into what we can create over there? And so you come through a period of time where hospitals and nursing homes were somewhat disjointed. The medical community, totally outside of any of that for the most part. There weren't many employed physicians or anything. And so how can you morph that? And so first conversion for me was getting out of the legal practice and really focusing on what I wanted to do, what we could do collectively. And then the other was, how do we bring 4 hospitals and 3 nursing homes and make that more integrated as a system? And so, shoot, by the time I retired, there were 30-some hospitals and almost 40 long-term care facilities out there, this and that. Totally different structure, and you work through everything to do it. Well, there's lots of challenges in all of that. One of the challenges, of course, is you had local community members and sisters on the hospital boards. Well, board members up in Aberdeen didn't want a lot to do with board members down in Sioux Falls. They're almost competing with each other. So how do you bring that along collectively? It's a long journey. It's a 25, 30-year journey to get that all done.
So we had two modest-sized Catholic healthcare systems in the state. Take us through the merger. What was that like, getting the 2 orders to agree on proceeding with a unified system?
Probably to get them to come together was a multi-year endeavor. As a lawyer, I still was doing some legal work for the Benedictine sisters out of Yankton, who had like Sacred Heart Hospital and St. Benedict's Hospital in Parkston and St. Michael's over in Tyndall, and hospitals in Nebraska and Colorado. And so I worked with one of the sisters who was given oversight, general oversight of the healthcare facilities. And we formed, on a legal basis, the Benedictine health system, just like we had years earlier formed the presentation health system. I had no role in that, other than just as an attorney, doing the paperwork and structure. And they wanted theirs looking different than ours. And so they became more of a confederation. So the CEO, if he didn't like what the discussion was at a system meeting, would just get up and walk out. And so there was really nothing, no glue or anything that held that together. So as they came through, we had some earlier discussions. Could the 2 religious orders with 100-year history, starting back in the 1800s, they were out here in healthcare as a ministry. And so as you bring all that together, can we work together? Well, it was kind of like the same community dynamics I mentioned between Mitchell or Aberdeen or Sioux Falls, is, no, we compete with you. It's not like we're under one big auspice. So they thought they could gain strength by joining a national alliance, eventually called Catholic Health Initiatives. And so they were part of that alliance with its corporate office, I think, in the Denver area, eventually. And so presentation was up here doing their thing. And then there came a time where a couple of the sisters on each side, both Benedictine and presentation, said, is there anything we can do together? We're in South Dakota. We're basically, for the most part, all in the Eastern South Dakota Catholic Diocese. Why are we competing like this? And discussions were held with the leadership teams of the orders themselves. And they just couldn't come to agreement. This would be early 90s. And so each had different visions of how this joint venture might work. And so they're gone. Fast forward then probably towards the end of the 90s, Catholic Health Initiatives told they had like 11 different Catholic sponsors, you need to turn over the assets to us. You can still have a role, but you're a sponsor out of 11. And all the facilities are owned by CHI. And the Benedictine sisters, I think, had a lot of pride in what they had done for 100 years. And so I can remember, I think I was on a motorcycle trip out in the Black Hills at the time, getting a call from Sister Easley with the Benedictine sisters, the prioress. And she said, we need to talk. So next day, I'm back in Yankton, South Dakota, where I was living at that time, and sat down with her, and she said, we have a choice to make. Either we can make this work coming together, or we're turning everything over to CHI, which is kind of what happened with a different Benedictine group in Pierre. That became part of CHI, St. Mary's up there. And so I basically called the president of the presentation, Sister Joyce, and I said, here's what it's going to take. I said, we come together as equals, even though presentation health system was quite a bit larger than the Benedictine health system. I said, or they are compelled to go their separate way. And I can still remember Sister Joyce saying to me, John, this isn't our health ministry. This is the church's health ministry. Whatever it takes, we are stronger together than we're ever going to be apart.
So is it fair to say you were the maestro of the merger?
No, I was the courier.
The courier.
The courier. I'm thinking, in large part, it was the sisters' collective desire to have something much stronger than two separate competing parts. It turned out they were right.
So what year is the merger completed?
We went through, that did take 2 or 3 years, Jack. We put together a shared governing board without any control or assets for the most part coming together for about 2 years, and put some of the presentation sisters on it, some of the Benedictine sisters on it. Had to go out and come up then with a new name. We weren't going to be presentation anymore, and we weren't going to be Benedictine anymore. So that's where Avera came from. There's lots of interesting stories on any of that. The first one we learned is that we hired a professional company out of Denver to come in and give us names. First thing they did, they came back and said, you know, all the neat names are owned by the drug companies.
These are made-up names.
Made-up names. I mean, stuff Xaralto or something like that. Stuff you've never heard of before, but they own them all because they may want to use it down the road for a drug. And so I do take pride in that. I got out my old law school Latin dictionary, and I knew I wanted something that would start with an A or a B. I wanted to be
the
up
top
front
of the alphabet
when things are listed. Yeah. And so did find a term called Avere, A-V-E-R-E. And
Latin.
It's Latin, and it's a salutation, be well. And I go, whoa, this is going to be great. So we shipped that back to our professional group, and they came back and said, well, that might work. It can be what you want it to be. And any of these words, you can, since they're not really words, it can be what you say it is. But it has to be stronger. So they changed it instead of Avera ending in an E, Avera with a little grunt on the end, and that was the stronger one. So we paid them through the nose for the name we had come up with, but it worked. And so we're
Great story.
yeah, we're 25. I think this fall we're 25 years into being Avera. So
And were you the first CEO?
yeah, oh yeah.
And you served in the CEO role for how long, John?
Oh, as the CEO of Avera, we formally incorporated everything, I think, in about 2000, and then I retired in 2018, so 18. But I had been president and CEO of Presentation Health System for about 10 years before that. So I've had a lot of years. It's just that the system changed a little bit. It became a co-sponsored ministry rather than a single-sponsored ministry. That was one thing, Jack, that you talk about opportunities or challenges, that when we talked about putting the two Catholic systems together back in the late 90s, the Benedictine health system really wasn't structured like the present. We had Presentation Health System, we had CEO, COO, CFO, we had all kinds of senior management teams. We had group purchasing organizations to help buy supplies and food and all of that stuff that we had put together over 20-some years within PHS. Benedictine Health System just had the facilities. There was no staff, there was no CEO or anything like that. So it really worked well in bringing the two together, in that we already had all of the senior management staff. It was all there. Every one of us slid into, because there was no competition.
John, the merger of those two systems is a huge accomplishment.
Yeah.
But reflecting on your many years as in the CEO chair for the merged system, what are you proudest of as it relates to Avera?
Yeah, I would say probably the thing we're proud of is started back in the early 80s, I think like 82 or something like that. But as we and other major players back then, Sioux Valley Health System and a little bit Rapid City Regional were the players in the state of South Dakota. But we came in and developed, and what I think I'm most proud of, because I was very supportive of putting this together, is what we call quality health care close to home. And so we started to grow, and pretty soon we had like 28 hospitals just in South Dakota. We'd go out to county hospitals, we'd go out to community hospitals, we'd go out to Methodist hospitals, we'd go out everywhere and find ways of working with them, knowing that everything had to be basically under the ethical guidelines for Catholic health care facilities. You talk to a Methodist hospital, okay, you gotta operate now like you're under the Catholic everything. And so we did it. We just gradually, there's a lot of shared value there where people aspire to that. Working with community, not-for-profit hospitals, working with county, or a couple cases community, city-owned hospitals like that, putting that all together, and then we formed what we called a regional approach, rather than everything coming back to a big facility like Avera McKinnon, which does transplants and everything, a quaternary facility. Mm-hmm. Our model was good, accessible health care close to home. We set up, Aberdeen became a region. Well, we had Fulton and Written and everything, all part of that, working collectively together. Then we started to take a lot of our real tertiary care and put that out there where you can get good quality cancer care in Pierce, South Dakota. Right there, it's all done virtually. We did a lot of virtual stuff. We had the largest virtual care network at one time back when I was still working there in the United States. We were sitting there in like 30 different states with some form of e-emergency, e-intensive care, e-stroke, all of those things out there. And so we linked it all together virtually with trained staff out there to be the hands and eyes out there, everything that they want to be. But the medical specialists were here operating out of a big call center with virtual stuff.
So e-care.
E-care. And e-care put the back of that. We committed to going in to those communities and putting cancer care, as I said, some levels of heart care, cardiology care out there, so that everything didn't have to just air back or funnel right in here. And it maybe an overstatement is we did through intensive care, where you'd have video connections, and I'm thinking of like Marsh, South Dakota. So you'd have the hospital there, which was an old county hospital that we had taken over, and you had, I think, 2 docs at the time in the community. Well, we could get somebody that was basically in need of intensive care. Oh, you don't have to go to Sioux Falls, get an intensive care unit. We'll just treat you right here.
How many states are you serving patients? How many hospitals, clinics, employees, the size of the...
Yeah, I don't even remember, Jack.
the
Now,
amount
I
of the
do know
assets.
in our development over the years I was with what became Avera, is we went through what I called a divestiture and reconfiguration. Presentation Sisters had hospitals in Miles City, Montana, Polson, Montana. Benedictines had facilities, 2 or even 3, over in south of Denver in Colorado. They had the Madonna Home, a rehab hospital of national repute down in Lincoln, Nebraska. We went through and divested, in other words, transferred to other Catholic sponsors, all those facilities, and then turned around and came back and reinvested, went into communities, Esterville, Iowa, Worthington, Marshall, Minnesota, O'Neill, Nebraska, many communities around here got involved in all of that. So we came back, took the fringes, and really wanted to put it where everything would link. So if there had to be a transfer of a patient, whether I'm in Iowa, Minnesota, South Dakota, North Dakota, whatever, that we had that level of care in our system and didn't have to send it somewhere else like that. That really has worked well. There's a lot of our docs. We had about, when I retired, I think we were 21, 22,000. We were the largest employer, even considering the state, largest employer in South Dakota. Number 2 was Walmart. You know, we were with 22,000 employees.
22,000 employees.
Yeah,
Amazing.
that's good. And that's the other thing that we went through, Jack, was not just bringing the community hospitals and home together, but over even a longer period of time, is predominantly now most of the medical communities have come in, and we've put together an integrated model where you still have the private practice of medicine, but it's all part of Avera.
So you end up, being healthcare administrator on a grand level when all you wanted to be was a country lawyer.
Country lawyer, yeah. So
Along the way, who have been the role models and the mentors who have really guided you? And maybe your wife Penny was one of those. But who's really made a significant difference for you in a positive way?
I would say it's a combination. I would admit up front, I am a lousy mentor, but I make a pretty good mentee. And so I sit there and learned from a lot of people, even people that reported up to me. I learned a lot from them. Probably the biggest one would be Don Barty that I mentioned. He's the one that drugged me into that. So getting me involved, and you really do get caught up and you get smitten by the commitment of the sisters to a health ministry and the legacy of that health ministry with 100 years and everything. And so it's easy to get drawn into that in there. And so that would be probably, without that opportunity from Don, I never would have even gone down that particular path. You'd have to give him credit for that. And then the sisters. I've had the sisters, being a good Lutheran, I've had the sisters kind of take me aside and say, you know, we got to be doing this and doing that. And our commitment to local communities, our commitment to our 22,000 employees is I've had sisters sitting right by my shoulder, even though I'm the president and CEO, they kind of tell me what I think, which is good. You know, that type of thing, really how we treat the least of us in our employee group. I had one of my co-workers one time says, John, you have to always remember that a lot of the people that work for you aren't there because it's a job. And it may be a nurse that just wants to be a nurse. No, they're there because of their opportunity to express their own beliefs in ministry, and they believe in that. And so giving them that opportunity within our facilities really has made a lot of difference.
So talk about your North Star. You know, what have been the guiding principles, the philosophies that you have clung to throughout your adult life?
Two things. Number one, the integrity and openness. As my mom used to say, yeah, don't ever do anything you wouldn't be proud of reading on the front page of the newspaper the following day. And so I've kind of, you know, we certainly have high integrity principles within the State Bar Association as lawyers, but to carry that into private, even though it's not for profit, but private type businesses, just absolutely nothing underboard, no slick tricks, no change in the bait or anything like that. So open. The other thing that I think I take a lot of pride in, Jack, is that we were very much on everything a team. And so at any given time, from the mid-'80s all the way into what Avera is now, had a series of senior administrative teams integrated with some of the religious sponsors who are still very, very active in what we put together. And so I learned from one of my regional presidents one time. He had a saying. He said, John, you know, none of us is as smart as all of us. And I go, you know, I got to thinking about that. We always had some very outspoken, focus-driven people in the management team. But we heard everybody out on every issue of any significance. It could be benefit programs for employees, it could be acquiring facilities, it could be integrating part of the system, development of virtual care, group purchasing, insurance plan that we had out there. So being very open on all of that, hearing everybody out, and then I did have an obligation to make the decision at the end of the day. But I had the benefit of the group think on everything, which was invaluable to me.
John, what experiences have brought you the most joy and fulfillment?
It was basically, Jack, for most of my career, it was boom times for healthcare. Healthcare is probably the #1 industry in South Dakota. South Dakota is an importer of healthcare. We get far more that come from Nebraska, Iowa, Minnesota into South Dakota for healthcare than goes out to Minneapolis or Des Moines or Omaha or Mayo or anything like that. And so as we put our structure together, we always had a strong revenue base which allowed us to do this thing on a financial stable basis. I always said that when I took over back in the 80s, is the sisters really entrusted me with something they had done pretty well for 100 years. And as some of the Lieutenant board members told me one time, but I was taking, okay, just don't muck it up. I go, I'm not gonna muck it up. So, no, it worked out well. So, you know, to bring all that stuff together like that, I think we take a lot of pride in what we've put together and the growth. And as I kind of look to the future, I know I've been asked, I mean, what do you envision? I've been out 7 years now, retired when I was 70. But I've been out and what do you wish for, hope for Avera going forward? And when I hear that, I go back to one of my other regional presidents, a lady had one of our facilities over in Minnesota, and I had asked everybody, I said, what do you think we should be doing? And she wrote a card and handed up, everybody handed up cards, and I looked at it. The first one was, keep on keeping. I said, what? Keep on keeping? I said, I don't even know what that means. Keep doing what you're doing. In a way, that's it. I mean, healthcare will change. It has to, but it's very expensive, and it becomes a significant burden on people. So we got to find ways to take a lot of that cost out if we can, but still be fair to our healthcare providers, our nurses, our clinicians, and everything. So structure will change. Will there always be 50-some little hospitals in South Dakota? The population really isn't growing much statewide. I mean, it isn't Sioux Falls, maybe Rapid, but it's not really growing much statewide. And so as you go back, what they need out there is going to change. And we have to evolve with it, whatever is out there.
John, what's something about you that people don't know that might even surprise your closest friends or colleagues?
Probably the fact that I did stay very involved, like the Hall of Fame board. I'm on the Hall of Fame board. I'm on the Mount Marty University board. I was on the South Dakota Community Foundation board. So did stay very involved in that. Intentionally did not go down the consulting, lecture, stuff like that. And I think a lot of people were surprised by that. But, you know, going up, there's a lot of pressure in a lot of different services and industries. And so I always tried to find some way to take the steam off. And I've always been very much into fitness. So I do a lot of running, I do kayaking, I do biking, I do fishing, I do some golf and this and that, take it off. And so when I had the opportunity of not showing up the next day, instead of trying to come up with the next gig, I actually went and played golf. I went and did things that I've been waiting to do more of, because that really saved me coming through all the years.
Imagine yourself as maybe a 20-year-old. If you could talk to a 20-year-old version of John Porter, what guidance would you give yourself?
If you were to come through from a high level, I think get yourself as much education, formal education, as you can. Once you enter the workforce doing something, be open to change. It's like me. The lawyer became a health system CEO. And you never know where it's going to take you out there. It's not like the old days, I think, anymore, that in large part, if you went to work as a mechanic or a line worker for General Motors, you were with General Motors your entire career. You were with IBM your entire career. You never change. And so for me, going back through that is, you don't, Jack, I never applied once for a job. I never interviewed once for a job. In all the different things I did, I was approached, would you be willing to come into our law firm? Would you be willing to come in and be part of administration in the presentation health system? Would you be willing? Would you be willing? And so that is unique. But the story there, I think, is that if you're willing to change the course of what you think you can do best and be value added on that, be open to it. Be open to it. As the old saying goes, and it's true. Do something you really enjoy doing, and you'll never work a day in your life. That is so true. I never thought. I used to go into the office early in the morning, long before I had to be. I used to like to stay late. I used to like to work on Saturdays and Sundays. You know, people don't do that much, but I enjoyed it. I really wanted to get in there. So.
John, one final question. When you're gone, how do you want to be remembered?
Well, be remembered at all would be an honor. Kind of like going into the Hall of Fame is somehow you get that recognition out there when you realize it wasn't just you. It was thousands of people behind doing all of that. And so I guess I'd want to be remembered for, as you mentioned, the integrity, open, the approachability that future president, in fact, they're on their second one even since my retirement at Avera because of Bob Sutton's health issue. And so as they get into that, one of the things that always hammered, certain of our facility COs just seem to be unapproachable. I mean, if they're going down the hall, they really didn't say hi or anything to her, nurse, this or that, just aloof like that. We were never like that. I mean, we'd gather in the morning for stand up and talk about some aspect of healthcare, the ministry, or this or that. And it could be a secretary there, it could be the president of the system standing there. And so we really tried to convey a lot of that within our organization. So the approachability, the visibility, the openness, and I do want to be remembered, I think, that everything was group input, final clarity of decision, and everybody get behind that. But I think that's good.
John, thank you so much. You've given us great insight, and I hope that this interview will be educational, especially
Sure.
for young people who are contemplating their futures. You've had a rich and fulfilling life, and congratulations for your induction into the South Dakota Hall of Fame. You represent us well. So thank you so
Jack,
much.
thank you so much. It is an honor to be in the Hall of Fame. It's an honor to be interviewed like this, so I appreciate it.
If you enjoyed this interview, you can learn more about the South Dakota Hall of Fame and South Dakota's greats by visiting our website at www.sdhalloffame.org.